So my name's Raj Jena. I'm a radiation oncologist working up at Addenbrooke Hospital in Cambridge. And I have an interesting job. I do 50% clinical work looking after patients with tumours of the brain and spine and other types of radiation therapy treatment. And I do 50% research work, and my interests are in applying different computing techniques and bringing them into our clinical practice to see how we can improve on what we currently do. The workflow for radiation therapy can be very intensive. It involves looking through lots and lots of slices, lots of images of a patient's anatomy and carefully outlining what is tumour and what are the critical structures that we want to avoid with radiation therapy. And depending on the nature of the tumour, that can take several hours of time. Not only that, but it's actually a difficult process to learn and get experience from for our doctors who are actually training in radiation therapy. And so I've been interested in two aspects really. First of all, encoding our expertise in how we actually do this. How is it that somebody who's done one of these types of treatments for over 10 years, how can they convey that information to somebody just starting from the beginning? But also perhaps using computing techniques to actually speed up the process so that a lot of the heavy lifting can be done automatically by the computer instead of the operator. So it was an interesting process. It started about 6 years ago together with colleagues from here in physics. And what we did first was we got the computer to help us. So we developed techniques whereby the computer could look at imaging and actually try and identify where the edges of tumours might be, so that then we could give the computer hundreds of cases that had been carefully prepared so that the computer could learn from. Once the computer has learned from them, then of course it tries and does it automatically, so then the computer is helping us rather than the other way around. And what's been really fascinating is developing both sets of tools, because you hear a lot about AI in the press, particularly general AI, and I think what's my experience has been that the devil's in the details. It's actually working through how to use AI techniques to really help solve one particular application, and that's been the way to do it in my experience. If you look at when we started, we were using very general techniques to provide assistance, and it was still taking the computer perhaps an hour of time to actually try and prepare a radiotherapy treatment, so about the same as a human observer. Now it takes about 4 minutes, so it's a good deal quicker. And I think it will just get faster and faster. So what will happen is that the computer, with the assistance of the user, will be able to look at not just one set of scans for a patient, but many sets of scans for the patient, and give you information as to how treatment is progressing and what's happening to a tumour whilst you're sitting and having a cup of coffee. There are some types of cancers where we have an awful lot of patients to treat. Mm-hmm. So the common cancers like breast cancer in women and prostate cancer in men, undoubtedly that will allow us to work more quickly, and it will allow us to treat more patients than we can at the moment. For brain tumours, I think it will be more helpful in actually determining how a treatment is going to work and how well a treatment has worked, because those details are quite difficult to assess. They take a long time, and what it will mean is that when somebody's coming for treatment or is coming back after completing treatment, those assessments will be performed much more quickly. So if you get to the Maxwell Centre very early in the morning, you may see a strange buzzing object either flying from the building, around the building, or through the middle of the building, and I'm afraid that's me. So building quadcopters and flying them is a bit of a passion of mine.
So you build your own?
I do, yes. And so, it's one of the things I get here early in the morning, and before anyone else is here, I have a quick flight. It's a good way of relieving stress.